People across Ontario are entering a third state of emergency since the pandemic began, and as of midnight tonight must observe a strict stay-at-home order for the next 4 weeks. ICU doctors say it is long overdue, and the hesitation has led to more illness and death. More than 3,200 new COVID cases were confirmed in Ontario today. 17 more people died, and for the second day, more than 500 people are in intensive care, a record number. We'll get to the stay-at-home order in a moment, but first we want to go beyond the numbers and the politicians to the life and death moments playing out inside an intensive care unit right now. The patients are young, many got sick at work, the doctors and nurses are exhausted. Jeff Semple has our top story tonight.
This Toronto hospital is jam-packed. That alarm ringing through the halls is code blue. A man in his 40s just arrived with a suspected case of COVID-19 and his heart stopped. Staff in the emergency room inserted a ventilator tube and saved his life, while other patients are lined up in the hallway just outside.
I haven't seen anything like this in my entire career so far, where we're this full and we're anticipating to be even more full.
Hospital staff are seeing firsthand what those dangerous, contagious COVID-19 variants can do.
It's hard. I mean, these variants of concern are definitely have definitely changed the game.
And if you walk the halls of the ICU, you can see up close the changing face of this pandemic. We were here in the first and second waves, where you largely saw elderly patients sitting in these rooms, but these days there are a lot more people who are younger.
It's hard to stomach when you see young people that are otherwise well, that you wouldn't expect to see this sick.
Most of the seriously sick in the ICU are now under the age of 60, the youngest just 21. And many here became sick at work.
We are seeing that a lot of these people are in fact essential workers.
The risk facing frontline workers is something Leo Ju's family knows all too well.
I'm really worried.
The hospital's emergency ward manager recently received news that his latest COVID-19 patient was his own aunt.
To see my personal family member going through this COVID is a completely different experience.
It was really scary. It's really high fever.
The 55-year-old nearly had to be intubated, but is now recovering. The massage therapist believes she became infected at work. Hospital staff are now calling on the province to make essential workers, regardless of age, the top priority for vaccination.
Grocery stores, the Amazon warehouse, things like that are all frontline that get exposed to COVID. So I do think it's important to realize that population is at higher risk at this point.
This ICU doctor says the biggest challenge now facing his team isn't a shortage of beds, but staff. 13 months into the pandemic, many of their colleagues have quit.
They couldn't handle it anymore. We lost a lot of nurses in the past few months, and it has brought a big toll on us that we are left to fight this.
And the result of that staff shortage? Even some available beds are now sitting empty. Jeff Semple, Global News, Toronto.
We want you to hear another voice from an intensive care unit. Dr. Michael Warner cares for patients at Michael Garron Hospital in Toronto. He's been using Twitter to post updates about what he is seeing, about the people who are dying. His post today is about how variants are killing younger people, and he has a call to action for politicians. Here it is.
I've been able to share some patient stories which I think have been helpful in connecting the numbers to real lives. But some people do want numbers to frame how they view this situation. So here are some from Critical Care Services, Ontario. In wave 1, we lost a patient to COVID-19 under the age of 50 in our ICUs every 6 days. In wave 2, we lost one every 5 days. In wave 3, we're losing one every 2.8 days. At the end of wave 2, there were 44 patients with COVID-19 in our ICUs under the age of 50. As of April 4th, there were 68. I think this trend is going to continue because variant COVID is a different disease. So what do we need to do? How do we not squander this stay at home? How do we make it worthwhile? We need to go after COVID-19 where it is, and that's in those high-risk postal codes. It's in those essential workplaces. We need to vaccinate those individuals, provide real workplace safety that's enforceable, rapid tests in congruent work settings, Pay people not to go to work if they're feeling unwell. Don't wait until they get COVID to give them 2 weeks off. Unless we address the root cause, these 4 weeks or however long it will be squandered and more people will die. Thank you.
Ontario did announce today it will send mobile vaccination units to high-risk neighborhoods, congregate settings, and large employers, and that everyone 18 years and older in those places will be able to get vaccinated. It's part of a new approach from Ontario's Premier, who has been under pressure for days to act.
I can't stress this enough. Things are extremely, extremely serious right now, and I'm extremely concerned.
Eric Sorensen explains what the stay-at-home order announced today means and what it's hoped it will lead to.
Time is ticking down in Ontario, the last day for non-essential shopping before most doors are slammed shut.
Bought Mama some flowers.
Oh, that's nice.
So we try to be productive.
You can sense the dread.
Again, with a lockdown?
More than a lockdown, a province-wide stay-at-home order.
The reality is, despite everything we've done so far, the COVID-19 situation in Ontario is getting worse.
High hopes for a normal spring have been dashed by one simple dynamic. COVID variants are spreading serious illness faster than vaccines can be administered to protect us. So, the order across Ontario, stay home, except for getting groceries, prescription drugs or other essentials, or for medical appointments, or exercise with members of the same household. For businesses, grocery stores and pharmacies remain open, big box stores are limited to essential items only, and non-essential retail can have delivery and curbside pickup only till 9 p.m. And then vaccines, expanded programs for lower age groups, high-risk workplaces and certain postal codes, plus vaccines at more pharmacies and mobile clinics in areas with high COVID numbers. But most schools outside the Toronto area will remain open.
Given that this is our best chance to halt this disease, to give us time to vaccinate, why not pull out all the stops, including schools, in order to let that happen?
Evidence of the need, the surge in hospitalizations that have spiked today to almost 1,400, approaching the peaks seen in January, and numbers still rising. For some, the province has responded too slowly to the third wave.
That's probably not a bad thing, and probably should have been province-wide much sooner.
And it is a body blow to the mental health of so many who've been locked down for months.
So I've just been working. I'm exhausted.
Katie Bones is a private nurse, just coping.
It's all up in the air all the time. So frustrating. Sick of it.
Allison Rains says it's hard.
It's a long game. I definitely feel the strain on my mental health.
There is a lack of awareness of how seriously mental health is affected, says one expert.
I think people are overwhelmed with the everyday life. Something around 40% of the general population is suffering from anxiety or depression.
And now begins another month of anxiety. Even children like Isla have had enough.
Let me out. We've been in this pandemic for 1 year now. Can't this be canceled?
The pandemic cannot be canceled, and a stay-at-home order cannot be postponed any longer. Eric Sorensen, Global News, Toronto.